Here is the text written down again as requested. Initial care of the newborn. A. Assessment, respiratory initiation. Observe or assist with the initiation of respirations after birth. This is crucial for ensuring the newborn begins breathing effectively on their own. APGAR score evaluation. Assess the APGAR score at 1 minute and 5 minutes post-delivery. This quick test evaluates the newborn's physical condition and determines if immediate medical care is needed by scoring 5 criteria. Characteristics of cry. Note the quality and characteristics of the newborn's cry, as a strong, lusty cry typically indicates good health, while a weak or absent cry may be a cause for concern. Respiratory monitoring. Monitor for signs of respiratory distress, including nasal flaring, grunting, retractions, pulling in of the chest wall, abnormal respiratory patterns such as seesaw respirations, where the chest and abdomen rise and fall asynchronously. Cyanosis assessment. Assess for central cyanosis, a bluish color indicating lack of oxygen, and acrocyanosis, bluish color in hands and feet, which can be normal in the first minutes after birth, but may require further evaluation. Vital signs. Obtain vital signs, including heart rate, respiratory rate, and temperature, which are critical for assessing the newborn's overall health. Thermal stability. Observe the newborn for signs of thermal instability, indicating potential hypothermia, low body temperature, or hyperthermia, high body temperature. Anomalies check. Assess for gross anatomical anomalies, visible physical deformities that may need immediate attention or further evaluation. Gestational age estimation. Estimate the newborn's gestational age using approaches such as the Ballard scale, which evaluates physical and neurological criteria. After birth, it is important to keep in mind that the newborn's skin may be contaminated with blood and amniotic fluid. Therefore, gloves should be worn when handling the newborn until a proper bath is given to remove these contaminants. Airway clearance. If necessary, suction the newborn's mouth first, followed by the nares, nostrils, using a bulb syringe to clear any secretions. Drying and stimulation. Gently dry the newborn's body to prevent heat loss and stimulate crying by rubbing the back, encouraging effective breathing. Maintain temperature stability by wrapping the newborn in warm blankets and placing a stockinette cap on their head to prevent hypothermia. Facilitate bonding. Keep the newborn with the birthing parent immediately after birth to promote bonding. This can enhance emotional connection and stabilizes the newborn's temperature. Breastfeeding support. If breastfeeding, chest feeding is planned, place the newborn at the birthing parent's breast or chest to encourage feeding behavior and skin-to-skin contact. If needed, place the newborn in a radiant warmer to maintain a consistent temperature, especially if they are unable to do so on their own. Identity confirmation. Ensure proper identification of the newborn. This includes following agency protocols for identification procedures. Fingerprinting. Perform footprinting of the newborn and fingerprinting of the birthing parent on the identification sheet in accordance with agency policies for safety and identification purposes. Matching identification bracelets. Place matching identification bracelets on both the birthing parent and the newborn to ensure consistent identification and prevent mix-ups. C. APGAR scoring system. Items to be scored. The APGAR score consists of 5 items, each scored from 0 to 2, with a maximum score of 10. 5 vital indicators as outlined in Table 28.1. Indicators 0 points, 1 point, 2 points, to 10. Heart rate. Absent 100 beats per minute. TWA 100 beats per minute. Respiratory effort absent, slow, irregular breathing, weak cry, good rate and effort, vigorous cry. Muscle tone, flaccid, limp, minimal flexion of extremities, good flexion, active motion, reflex irritability, no response, minimal response to stimulus, responds promptly with a cry. Skin color, pallor or cyanosis, body normal, extremities blue, normal body and extremity color, adapted from Murray S., McKinney E., Holub K., and Jones R., 2019. Foundations of Maternal, Newborn, and Women's Health Nursing, 7th ed., Elsevier. Interventions based on APGAR score as outlined in Table 28.2. Score interventions of maternal, newborn, 8 to 10. No intervention required except to support the newborn's spontaneous efforts. Stimulate. Stimulate, rub the newborn's back, administer oxygen, rescore at specific intervals. 3. Full resuscitation required, rescore at specific intervals. The APGAR score serves as a vital tool for quickly assessing the newborn's health and determining the necessity for immediate medical intervention. Let me know if you'd like any adjustments or additional details.